February 1st began Heart Disease Month and unfortunately began with the death of Carl Withers, who was an actor who died of a heart attack. You may have seen him in Mandalorian or as Apollo Creed or on The Predator, a very well-known actor. Heart disease is the #1 killer in the United States, and I want to talk to you about coronary artery disease. The arteries that feed the heart are the things that cause the heart attack when they get clogged with atherosclerosis. And what causes them to be clogged with atherosclerosis? High cholesterol in the blood. I realize there are people out there who don't believe that, but the evidence is clear. Low density lipoprotein, a portion of the thing, has something called ApoB, and it starts depositing on your blood vessel wall over time, and eventually it gets thicker and thicker, and if that plaque, which kinds of plaque, ruptures, you acutely have a heart attack. What are things you can do to decrease your risk of heart attack? There's several things you can do. #1, stop smoking. Even though the AMA was against smoking and the Surgeon General was against smoking, it wasn't until we made the cost of cigarettes high that we saw smoking go down. And heart disease went down as a result of it. #2, get your cholesterol under control. You can do that with the help of your doctor. Lifestyle changes, Mediterranean diet, cardiovascular exercise are brilliant for that. Often they are not enough. And finally, get your salt under control. Salt increases high blood pressure increases atherosclerosis. Get that under control. And certainly if you have diabetes, get that under control. The final mechanism of all of that atherosclerosis, however, is that cholesterol. I'm going to give you 2 clinical genetic instances. There are kids who have familial hypercholesterolemia who have heart attacks pre-teen years. And there are people who are in their 90s who have such low density lipoprotein that they live to be in their 90s. They can be smoking and drinking and have diabetes and not die of heart disease. So we know this is the causative agent and we know how it does. So what can you do? Mediterranean diet, decrease the sodium, stop smoking, get your blood pressure under control, get a blood pressure cuff, learn how to use it with your doctor, take it at home when you're quiet, not quickly in the doctor's office. And those are the things that you can do to help you have less of a risk of being a statistic. We're seeing the numbers go down. They can go down further. Do the interventions you can do.